Hi guys, can you hear me? Hello.
Yes, we can hear you.
Okay. So,
Yes,
right. Right, I'm going to start. Can you see my screen?
yes.
Yeah. Okay. So, I need your full attention because it's quite a complex topic today, but it builds on from like last lesson, okay? So, don't worry. So, the title is cardiac vector and vectoral analysis. So, we're just going to focus on like one specific vector today. I'm going to explain everything. Like I'm going to try my best. Right, so just quick recap from last lesson. So, what does the horizontal axis measure in the ECG? Do you remember?
Is it QRS?
No, the horizontal axis, which is this axis. What does it measure? This axis here. What does that measure?
Time.
Time, yes. How, okay, so one small box is how many milliseconds?
40.
40 milliseconds, yes, which is also equivalent to zero point zero 0.04 seconds, okay? So one big box then is how many seconds?
Zero point 0.2.
Zero point 0.2. So it's essentially just timesing that by 5, right? So we got zero point 0.2 seconds or 200 milliseconds. How many big boxes in 1 second?
Five.
5. Okay. I hope everyone's following because you need this knowledge for today. So what does the P wave represent?
Atrial contraction.
Not contraction, atrial
Depolarization.
depolarization. So there's a difference because the atria can depolarize, but not necessarily will generate an effective contraction. Okay, so it's different. Depolarization is like the signal to contract. Okay, what does the vertical axis measure? So this axis here, this vertical one. What's that measure? Do you remember?
Voltage.
Voltage. Okay. And for the vertical axis, this is how I remember it: vertical V, voltage. Okay. So for one small box in this vertical axis, how many volts is that? One small box.
Is zero point 0.1
zero point 0.1 unit
millivolts.
millivolts, yes. So where is the atrial repolarization on the ECG paper? I mentioned this last week.
QRS.
Yes, it's superimposed under the QRS. So it's somewhere here, but we can't see it because the QRS depolarization is higher in magnitude because the ventricles have more mass compared to the atria. Okay, so it's hidden under the QRS wave. So atrial repolarization, by the way, is also called the atrial T wave, and it's hidden under the QRS. So what does the QRS wave represent?
Depolarization.
Of which
Ventricle.
okay, ventricular depolarization. What is the Q wave? This wave here. I don't think I mentioned this, but I don't think I mentioned this last week. So Q wave is the first downward deflection after the P wave. So this is the P wave, and whatever downward deflection comes after that is the Q wave. And the Q wave represents septal depolarization. This is important for today's lesson. Q wave is actually the depolarization of the septum. It's the first to be depolarized in the ventricles, okay? The R wave is the first upward deflection after the P wave. So the R wave is this wave and the Q wave is this wave. So Q wave is the first downward deflection after P, R wave is the first upward deflection after P, and S wave is the first downward deflection after R wave. So S wave always has to follow R wave. Okay? And what does the T wave represent?
Repolarization.
Of which
The ventricles.
okay, ventricular repolarization. So just quickly look at this bit because the QRS like confuses a lot of students from my experience. So I told you that the Q wave is the first downward reflection after P. So imagine we always have a P wave here. If we don't see a downward deflection after P but an upward deflection, it's just called an R wave. So if there's no downward deflection but there's an upward deflection, then a downward deflection, it's called an RS wave. Okay? If there's no Q wave, but then there's an upward deflection, then down, then up again, it's RSR wave. So these are just different like QRS presentations, okay? So it doesn't necessarily mean pathological. It depends on which lead. So for instance, um, if you see this on like lead V1 or V2, it can represent like a right bundle branch block. Or if you see these deep QS waves in V1 or V2, then it can be like a left bundle branch block. So it just depends which lead you're looking at. But don't always search for a QRS wave, like a perfect wave like that. Because sometimes you don't have Q, sometimes you don't have S, sometimes you just have Q and S with no R. So don't let that confuse you, okay? So this is just general knowledge. So what does depolarization actually mean in terms of membrane potential? When we depolarize something, what happens to the membrane potential?
You get an increased membrane potential. So like you get more, I think, sodium and calcium ions.
Yes. So sodium and calcium, they carry a positive charge, right? So when they go inside the cell, they make the cell more positive. So
Yeah.
depolarization, like you said, the membrane potential becomes more positive because of the influx of positive ions. Okay.
Yeah.
So what does repolarization mean then in terms of membrane potential?
It becomes more negative.
More negative or less
The
positive?
potassium ions for repolarization.
Sorry.
So what was the question?
So depolarization. So what is depolarization and repolarization in terms of membrane potential? So
Uh, so even in repolarization, where the sodium ions are influxing, so it becomes a positive outcome of the cell membrane, whereas in the repolarization, when the potassium ions becomes less more negative in a way.
yes, yeah, you're exactly right. So depolarization, influx of ions make the cell more positive, and repolarization they exit, so the cell becomes less positive or more negative. Okay. So just checking that you know all of this because we need this for today. Right. So what is this rhythm? We've seen this
Is
last.
that sinus rhythm?
Yeah, it's normal sinus rhythm. Okay. So I hope you know why. It's because we have P waves before each QRS and the same P wave morphology throughout. Our heart
But
rate
maybe
is
as
between.
well between each wave as
Yes.
well.
Yeah. What else? Do you remember the other criteria?
It's between 60 to 100 beats, as you said.
Yeah. What else?
So that means one of the boxes should be the same.
Yeah. It means regular rhythm, correct? How about the QRS and the PR interval? Yes?
They have the same in between.
Yes. So same PR interval throughout, and the PR interval should be between 3 to 5 small boxes, and QRS should be, do you remember?
83.
Yes, so less than 3 small boxes. So all of those are the criteria we need to say that this is a normal sinus rhythm where you guys recognized it, and that's great. It's good to recognize what's normal so you know what's abnormal. Okay? So for today's lesson, we're gonna add more layers into this. So you know that typically we use something called a 12 lead ECG, right? A 12 lead ECG. This is standard. So in a 12 lead ECG, lead just means different electrical views of the heart. So in a 12 lead ECG, we have 12 different ways of viewing the heart. So if you look at this picture here, these are the 12 leads. So these are the 12 ways in which we can view the heart. So there's lead 1, lead 2, lead 3, AVR, AVL, AVF, and V1 to V6. Okay? In this 12 lead ECG, we only attach 10 electrodes, 6 on the chest and 4 on the limbs. Okay. I don't know if you've ever attached electrodes on a person's body, but we only attach 10. And with these 10 electrodes, we can generate 12 different views of the heart. Okay. Because we can use the other leads to be like an electrode for another lead. So this picture here shows you where we attach the 10 electrodes. So we attach one on the right, this is the right and this is the left. So one on the right arm, one on the left arm, one on the right leg, one on the left leg. So these are your limb electrodes. So I don't want to confuse you. Electrodes are the physical things that we attach to the person's body. You know, the sticky things that we attach onto them are called electrodes. Whereas the different views that the ECG generates, the ECG trace, that's called a lead. Okay. And then the six chest electrodes are here. So the first, this is called V1. V1 is on the second or fourth intercostal space, right parasternal border. V2 is on the second or fourth left parasternal border. And then this is V4. We attach it on the fifth intercostal space, midclavicular. And then V3 is just between V2 and V4. V5 is fifth intercostal space, anterior axillary line, and V6 is fifth intercostal space, yeah, mid axillary line. Sorry, V5 is anterior axillary line, and this is mid axillary line. So it doesn't. At this point, you don't really need to know this, but just if you're interested, that's where we place these leads. And we have a total of, sorry, not leads, electrodes. We have a total of 10 electrodes, and with those 10 electrodes, we can generate 12 different views of the heart. So we attach 10 electrodes, 6 on the chest, 4 on the limbs, and then 12 leads of the ECG represent 12 electrical views of the heart, as shown here. So we have 12 different angles, basically, that we can view the heart from. So we have 6 limb leads. So limb leads are the ones in blue. So lead 1, lead 2, AVF, 3, AVR, and AVL. And we also have 6 chest leads, which are here, V1 to V6. Okay. So the 6 limb leads look at the heart in a vertical plane, and the 6 chest leads look at the heart on a horizontal plane. So don't worry about this. This is not important for today, but just remember we have 10 electrodes. But with this 10 electrodes, we can generate 12 electrical views of the heart. We can generate 12 leads. So is that clear before I move on? Because you need this knowledge today. Do you guys get that?
Yeah.
Yeah? The difference between electrodes and the leads, okay? Electrodes are the physical things you attach from the person's body. The leads are the different electrical views of the heart. Okay? So how do we measure voltage? So this is basically how do we generate the ECG trace. So I don't know if you did like a physics lesson, but when I did physics, we use a voltmeter to measure voltage. And with the voltmeter, we have to place two different poles. So the measurement of voltage requires two poles, a negative and a positive pole. Pole is just like an electrode, okay? So we put two electrodes or pole on either side of the heart that can measure the voltage like a voltmeter. So for instance, if I place my negative pole here and my positive pole here, connect them onto a voltmeter, then I can measure the voltage between these two poles. Okay? So the negative pole, this pole, the negative one, is the zero reference. And the positive one is the pole of view. So the pole of view means that, look at this one, this diagram there. So the pole of view means that we're actually looking at this lead from the positive pole. So the eye is there. So I'm looking at it from like the inferior side, the right, no, yeah, the right inferior side. Okay. So negative is the reference, and positive is like the pole of view where I'm looking at this lead from. So if the current is moving towards the positive electrode, so I'm just gonna draw a line here to complete the circuit. So if where is it? If the current is moving towards the positive pole or electrode, the voltage recorded is positive. And on the ECG paper, this would be a positive or upward deflection. Okay, so this means if my current is moving towards the positive pole, if my current is going that way to the positive, the voltmeter would register this as a positive voltage. So I'm going to give this like a value, let's say this is just a random number, like 5 volts, okay? And on the ECG paper, because it's moving towards the positive pole, it's going to be an upward or positive deflection. And then if the current is moving away from the positive electrode, the voltage recorded would be negative. And on the ECG trace, this will be a negative or downward deflection. So if we have a current that's going away from positive, so if we have a current going towards the negative now, yeah, towards the negative side, away from the positive side, the voltmeter would register this as a negative voltage. And on the ECG paper, this is going to be a negative deflection. Is that clear so far, guys?
Can you repeat, please?
Okay. So, okay. Right. So what I've done, so to measure voltage, we need to put two different electrodes. We need a positive electrode and a negative electrode to be able to measure voltage. Okay? So I put a negative electrode there and I put my positive electrode here. And then I just connected them and I connected that into a voltmeter. This is my voltmeter, this box here. A voltmeter just measures the voltage. So if I have a current that is going towards the positive electrode, so if my current is going here to my positive electrode, it will be a positive deflection on the ECG trace, and on the voltmeter, it will be a positive voltage. Okay? And if I have a current that's going away from the positive towards the negative, it's going to be a negative deflection on my ECG paper, and the voltmeter would register a negative voltage. Is that clear?
Yes.
Yeah? Okay. And the negative pole is just the reference. It's just called reference electrode. And the positive pole is just called the pole of view. These are just terms, okay? That you need to know. Okay. So I'm gonna erase this. So if the direction of the current is fluctuating, the voltage will also be fluctuating. Okay. And this is why we have a positive and negative deflections in the ECG. So the impulse traveling across the heart is going in different directions. It's not just going into one direction. This is why, on the ECG trace, we have P wave, which is positive, and then negative Q, then positive R, then negative S, and then positive T. The reason why we have these negative and positive deflections is because the current is moving in different directions. It's not just moving into one direction. And I will show, this is the point of the video, I will show you that in a bit. So yeah, when we place two electrodes in different points of the body, we can create an imaginary circuit. So exactly what I've done here. So I've connected this into like a voltmeter and I made an imaginary circuit. And that imaginary circuit is called a lead. So this connection there, that imaginary circuit, is called the lead. Okay, and this is called an electrode. That's an electrode, but this is a lead. So the magnitude of deflection is indicative of the amount of the heart tissue that's depolarizing. So I think I briefly mentioned this last week. So I explained why the P wave is small compared to the QRS wave. And the reason for that is because the P wave the atria, they have a much smaller muscle mass compared to the ventricles. The ventricles are massive compared to the atria. That's why we see a bigger magnitude of deflection for the QRS and a smaller magnitude of like deflection for the P wave. Okay, and this is very important. This last statement, which you would need today, the vector is always showing the direction from the depolarized end to the non-polarized end. Okay, so please try get this in your brain. So the vector is always gonna show direction from the depolarized end to the non-polarized end. This will make sense in a bit when I explain everything. Okay, so that was a lot of information. So I'll check if you guys got it. So if the current is moving towards the positive lead, the voltage recorded is
Positive.
positive. And on the ECG paper, this will be a what deflection? If a current is moving towards the positive lead, the voltage recorded is positive. And on the ECG paper, is this going to be an upward or a downward deflection?
Upward.
Upward deflection, yes. It's going to be positive or upward deflection. You can say positive or upward. Okay? If the current is moving away from the positive electrode, which means towards the negative, the voltage recorded is
Negative.
negative, yes. And on the ECG paper, this will be a what kind of
Downward.
deflection? Downward deflection or a negative deflection? Downward or negative? Okay, so on the ECG trace right here, which ones are the positive deflection?
The QRS thing. So when it goes to Q2R, would that be a positive one?
So this is P, this is Q, this is R, S, and T. So Q, R, S are separate, okay? So which ones did you say are positive deflections?
So when it goes from Q to R, would that be a positive deflection then?
Yeah, so just say R because the
Okay.
positive is R. So Q is actually that bit.
That little, okay.
And then R is the positive, and then S is the negative, okay? So R. How about other deflections that are positive?
P and T.
Yes. P and T. See, you're getting this. I'm happy. Okay. So which ones are the negative deflections then?
Q, S.
Q and S. Q and S, negative. Okay. So we have an isoelectric line, which is just the baseline, like the flat line thing. This bit, yeah. So, what is it actually showing us? What do you think?
There's 0 voltage, that's like an equilibrium kind of thing, like 0. So the voltage is neither going upwards or downwards, that's maintained.
Yeah. So there's no movement of current, okay? Because the ECG is just recording the movement of current. So it's no deflection, neither positive or negative. It's just no change in current. Okay. So that's that. Right. So for this video, because vector analysis you have to do for literally all the leads, we're just gonna focus on lead two. Otherwise, we'll be here till like next Tuesday. Okay. So lead two. Okay. Lead two represents the voltage between the right arm and the left leg. So this is lead two, guys. This is right arm and this is left leg. And lead two, I told you the lead is the imaginary line between those two poles. So this imaginary line, this lead is lead two. So notice that the positive pole is on the left leg and the negative pole is on the right arm. Okay? So positive pole or electrode is on, so for lead two, the positive pole is where?
Slag.
Left leg, yes. So left leg. The negative pole or electrode is where for lead two?
Right arm.
Right arm. So this means that the pole of view is always from, because this is the negative pole is the reference pole and the positive pole is the pole of view. So this means that this gives us a view from the inferior side of the heart. So this is an inferior view of the heart. So the eye is here. So we're looking at it from this angle. Okay, right. So this is the vector analysis. So the vector analysis just explains as to why in a specific lead we see these types of deflections. So this is lead 2. We're gonna do lead 2, okay? So in lead 2, the negative pole is on the right arm, correct? So right arm is around about this, like here, and the heart is there, and then the positive pole is on the left leg. Okay, so it's like this, and then the imaginary line, the lead, is here, and we're looking at it from this view, from the inferior view. We know this so far, right? So why do we see a positive deflection for the P wave? P wave is atrial depolarization, and the impulse starts from where normally?
SA node.
SA node. So SA node is this thing here. So when the SA node sends an impulse, it goes and spreads all over the atria. But the general trajectory of the vector, it's going this way to the AV node. Okay, so the direction is generally that arrow to the AV node. So notice this arrow is pointing to the positive end, correct? It's pointing towards our positive pole. So if it's pointing towards our positive pole, what does that mean? Is this going to be a positive or a negative deflection?
Positive.
Positive. This is why we see on lead 2, guys, a positive P wave, a positive deflection for the P wave, because the vector is moving, well, it's going to the direction of the positive pole. Okay? And then we encounter the delay in the AV node because the atria needs to fully contract to empty the blood into the ventricles. And then we see the Q wave. The Q wave is the first negative deflection after the P wave. So this is the P. So this why is this negative? Okay, this is really interesting. So I told you that the Q wave is what is the depolarization of which bit? Do you remember?
Sorry, what was the question?
The Q wave is the depolarization of what?
Septum.
Septum, yes. So Q wave is septal depolarization. It's the first thing that depolarizes in the ventricles. So the septum is, you know, the septum, like that line. That's the septum. Okay, this is the septum. So interestingly, in the septum, the left upper part is the first thing to actually depolarize, and the wave of depolarization. Some of them they go to the right side. They depolarize to the right side because it's from the left, it spreads towards the right. So now look at the direction of this. Is this going towards the positive pole or not? Do you see the arrows? They're not pointing towards the positive anymore, are they? They're kind of like perpendicular to the positive pole. So this means we're not going to generate an upward deflection. And some of them they're obviously depolarizing like that, so some of them will point towards the negative, some of them will point away from the positive. This is why we see this negative deflection. Do you guys get the Q wave, why it's a negative deflection? Do you guys get it, the Q wave?
Yes.
Okay, so after that bit has depolarized, the rest of the septum gets depolarized. So the impulse now then goes downwards like that through the bundle branches, the bundle of His, depolarizing this bit. And now, look at the direction of this. It's much closer to the positive, right? To the positive electrode. This is why we see this positive deflection. Because now we're kind of pointing towards the left leg, the positive pole. And it's a big deflection because the amount of myocardial tissue is quite a lot. Look, it's a big piece of tissue that's depolarizing.